Good afternoon, everyone. For the record, Chair Jazz Lewis, the Public Safety and an Administration Subcommittee hearing. Thank you all for traveling today. And we have a special guest in our chair being here. We're going to roll right into it, and we're going to start with workers' comp. So we're going to bring Micah Richardson to start with his analysis first. Then we'll have any questions from colleagues, and then Ms. Quinn, you can approach, and then we'll start. Thank you.
Like to thank the chair, the committee, and the great state of Maryland for allowing me to speak before you today. I am presenting the Workers' Compensation Commission Fiscal 26 Budget Analysis. In this presentation, I will refer to the Workers' Compensation Commission as WCC. Starting on page 1, the WCC receives, processes, and has 10 commissioners that adjudicates on-the-job injury claims. The fiscal 26 budget increases by around $656,000 compared to the fiscal 25 appropriation to a total of around $24 million. On page 2, 72% of the budget, which is around $17 million, supports personnel costs. On page 3, the largest increase in the budget compared to fiscal 25 is $1.6 million for salaries due to fiscal 25 cost of living adjustments. On page 4, the Comp Hub Enterprise Modernization Major IT Project replaced WCC's aging and complex system to go paperless and streamline operations for more efficient services related to their hearings. This is the largest decrease in the budget of $2.5 million due to the project being completed in December 2024. The total cost of the project was $23.9 million. DLS requests for WCC to comment on how the implementation of the new system has improved agency operations and the ongoing maintenance and operation costs for the new system. On page 5, as of December 2024, WCC has 18 vacant positions, which is more than necessary to meet budgeted turnover. On page 6 and 7, the WCC goal is to set 90% of hearings within 60 days of the filing date. Exhibit 3 shows the percentage of non-permanency hearings set within 60 days. In fiscal 24, WCC experienced an 8.6 percentage point decrease in hearings set within 60 days compared to fiscal 23, putting the agency below their 90% goal. This is caused by the challenges of implementing the new Comp Hub modernized system, which resulted in scheduling delays. WCC states that they will provide training for the WCC community users to get acclimated with the system. On page 7 and 8, WCC collects a payroll-based assessment from the state's licensed insurers. In fiscal 24 compared to fiscal 23, Exhibit 4 shows the total insurer assessment increased by around $2 million. The base payroll increased by around $8 billion. The commission expenses increased by $1.5 million. And as a result, the formula-based assessment rate per $1,000 of payroll increased by 1.4%. On page 8 through 12, I will refer to the Uninsured Employers Fund as UEF. The 2024 Joint Chairman's Report requested WCC and the UEF to establish a work group to study and report on potential changes to UEF's funding structure and operations due to the concern of the long-term solvency of UEF. WCC and UEF submitted separate reports. WCC noted as of September 30th, 2024, UEF fund balance was around $7 million, a $2 million increase from the fiscal 24 closing fund balance of around $5 million. Exhibit 5 shows UEF's expenditures exceeding revenues in fiscal '23 and fiscal '24. Exhibit 6 shows that the increase in administrative costs is the primary cause of spending exceeding revenues. Corvell is UEF's third-party administrator, which is also called TPA. Corvell provides insurance claims management to secure payment of injured workers' lost wages and medical bills. WCC noted that if this data from UEF is accurate, Corvell secured payments totaling $25 million and was paid by UEF $11.5 million in the last 5 years. WCC noted that the cost ratio of the contract is not in accordance with industry standards. The Board of Public Works approved on October 30th, 2024 for Corvell to remain as TPA through October 31st, 2029. Corvell would receive $8.4 million by the end of the term. UEF stated that they expect for Corvell's costs under the contract to decrease by approximately 20%, and WCC noted concerns regarding whether the reduction is adequate and if the costs are in line with industry standards. WCC recommends the possibility of an overseer to monitor UEF balances, TPA administrative fees, UEF staffing needs, and establish standards for reserves. WCC notes multiple potential recommended changes. The changes that do not require legislative action are transferring claims management in-house, hiring a private commission-based collections agency to pursue debts owed to UEF, and reducing the fines, penalties, and assessment to judgments and bring collection actions. The changes that require legislative action are WCC supports increasing the assessment's percentage on awards and settlements by 1 percentage point. WCC disagrees to make reserve setting mandatory. WCC supports repealing the suspension to allow UEF to address long-term needs. WCC supports to redirect civil penalties of workplace fraud from the general fund to UEF. WCC does not support transferring $10 million from the subsequent injury fund to UEF. DLS requests for WCC to comment on its recommendations for an overseer to evaluate UEF staff effectiveness to perform enforcement actions. Additionally, they should comment on their recommendation for a suggested increase in the assessment and the need to set mandatory reserves. On page 13, DLS recommends increasing the turnover rate by 3.73 to 7% for a reduction of around $554,000 compared to the fiscal '26 allowance. On page 14, Chapter 78 of 2024 increased the cap on penalties to $25,000 for employers who fail to comply with a WCC order. As of January 2025, no $25,000 fine has been issued at that level. This concludes my presentation, and I'm available for any questions.
Thank you, Mr. Richards. Colleagues, any questions for DLS? Seeing none, thank you very much. Commissioner Chair Quinn, please approach with anyone who is with you. Thank you.
Good afternoon, Chair Barnes, and thank you for always being a legislative guardian to our agency. I know this is near and dear to your heart. And good afternoon, Chair Lewis and Vice Chair Ivy and members of the committee. I am Maureen Quinn, and I am the chair of the Workers' Compensation Commission. I'm going to introduce my executive team here, but I want you to know they're not just coworkers, but they're people that are my trusted partner in leading this agency. And to my left is our CEO, Teresa Cornish, and to my right is our CFO, Dave Jones. And next to him is Jay Moore, our Director of Fiscal Services, and behind me is Chris Barrett, our Director of Human Resources. So I'll begin by saying that this year, more than other years, I'm especially mindful of the benefit of being a specially funded agency. We are funded 100% by all of the insurance companies that underwrite workers' compensation insurance in our state. And we send these companies a bill once a year, and they pay us promptly, and they pay in full, and that allows us to operate in a very stable fiscal environment. At the same time, the business community continues to enjoy a 15-year downward trend in the cost of buying a workers' comp premium. Premiums were reduced by 13.2% last year. And just by way of contrast, the property and casualty and auto insurance industries, their profits are under siege, but workers' comp continues to be profitable and is currently the most profitable line of insurance according to NCCI. And a profitable insurance industry has a positive impact not just on the employers, but also on injured workers. You asked me to comment specifically about CompHub and how it has affected our operations. Let me just say three things preliminarily about why we invested in this new system. First, our old system was at risk of catastrophic failure. It was no longer properly supported by IBM, and we needed to better protect our agency's data from hacking and ransomware, particularly because we store tens of thousands of people's medical records. We see that the computer system is changing our workforce, but we are still trying to figure out what those changes are and what we need in terms of our workforce and our vacancies. So I just want to give you an example. For the last 6 months, we have noticed that the number of cases awaiting hearing, what we call our pending caseload, is very low, in fact. And while that's wonderful for injured workers because they get a quick hearing, there are other ramifications that I have to think about. But right now, we know that we have the same number of requests for hearing, but is this just an anomaly that's going to resolve itself, or is this a permanent and accelerating trend? And if it is, I have to ask myself, can we keep our courthouses open 5 days a week? Do we have enough cases? And that causes me to wonder whether I could potentially lose personnel like court reporters and security personnel who need 5 days worth of work. So unfortunately, this is just one of those things we have to wait and watch and manage. Speaking of trends, this one is permanent for the foreseeable future, and it involves the age of our employees. So 42 of my 111 full-time employees are age 60 or over. That's 38% of our personnel, and that's 5% worse than last year. So beyond demographics, I know you want to understand why are we struggling with vacancies this year when we were headed in the right direction 2 years in a row. We've spent a lot of hours deciding how to change our PINs and our job classifications to meet the needs that we now have for our workforce. We haven't focused on putting bodies in seats just to make our numbers look good. We have reclassified 43 jobs. And that tells you that our workforce needs are changing. And just again, by way of example, CompHub has helped us reduce the number of people that we have that are clerical paper pushers. And so we have reclassified and retrained those workers to be claims reviewers so that they can do investigation and research and improve the accuracy of the work that we do. We are also very aggressive about letting people go within that 90-day probation period if they're not working out. And we can do that because all of our directors have said to us, I'd rather start all over, rehire, retrain, than live with an underperforming employee for 30 years. And I think that's the right approach. And I'll end with one last issue. I know we can all agree that people who do the same job should have the same amount of pay. But in state government, this has not even been close to being true for a long time. People who were hired from within state government have been discriminated against because the pay bump that they could get when they were promoted or transferred to another agency was limited to 12% at most. But if we hired people from the outside, we could hire them or had to hire them at market rates. So Governor Moore asked all the agencies to look at the salaries of people who did the same job underneath the same supervisor to make sure that they were being paid the same. We did that evaluation, and the results were disturbing. And I brought an example with me. I have several, but I'm just going to tell you about one that I think is illustrative. We had a unit that had 10 people in it. 5 of them needed raises, and I'm not talking about a couple $1,000s. One woman needed a $19,000 a year raise just to bring her on par with the coworkers she sat next to every day. Another employee needed $17,000 a year, another needed 12, the fourth needed 11, and the fifth needed $4,000. It was a total of $63,000 in salary increases just in one unit. But I don't want the story to be about the $63,000. The story is about this disgraceful discrepancy in pay. And given my agency's overwhelming female state workforce, this unfairness has had a disproportionate impact on the money women earn, and especially when you think about the money that's not earned per year multiplied by the number of years of pay discrepancy. I can only fix the problem going forward, but if we weren't in a fiscal crisis, I would be asking that we all look at these employees' salaries going back at least a few years and correcting their pay. So I want to give special thanks to Teresa Cornish and Chris Barrett for undertaking this analysis. But we also want to thank another agency that sometimes doesn't get enough credit, and that's DBM. DBM partnered with us to get this done, and they didn't rubber stamp anything we gave them. They closely analyzed our request, and they answered us promptly. And this week, DBM announced the hiring of a new HR chief, Neil Desai, and I will be writing him a letter. And I'm going to ask him to ask every single state agency to do this salary investigation, and I hope the legislature will demand this as well. And with that, I'll close and await your questions.
Thank you, Commissioner. We really appreciate the thorough review, and I guess I want to say I'm heartened on your approach of making sure that all of our workers get fair compensation too. It's not just in the work that you guys do, but that should extend to your staff. And thanks for sharing some of those stories with us. Colleagues, do you all have any questions for the agency? Well, I do have one. I wanted to know if you could just provide more comments on the contents of the JCR recommendations in response to UEF. And just, it seemed from what I was able to read that you didn't get as much collaboration as you would have liked. But if you could just, wherever you can expound, that would be appreciated.
Yeah, I had a very collaborative partnership with the UEF for the first 2 years that I was chair. But when the Budget Committee created this workforce and made us co-chairs of the legislative work group, it was pretty rocky, I would say. And part of it was that we thought we had 5 years to figure out how to prevent the insolvency of the UEF. That's what the actuarial report said. And then we found out at the first meeting that they only have $5 million left and they have 600 claims. And that, as the budget analysts have said over the years, that this TPA that they had for the past 5 years was, the price tag was just it was just too high, and it was breaking their bank. So while we deliberated, the new contract was before the Board of Public Works. So we were told we couldn't talk about it. So it all made it very difficult to even understand whether they were going to correct this problem. At the very end of the work group, in late October, they did have their contract renewed. And I think it's a good faith effort to move in the right direction in terms of getting their expenses under control, but their financial situation is very precarious. And the data that was released by the UEF was given only to me, and it was with the caveat that I couldn't share it with anybody on the work group. So it makes it very hard to be productive when I can't show anybody anything. So I have recommended that there be a monitor approved who will go to, examine the data that the UEF has, keep an eye on that bank balance. And I'm not sure you're aware of this, but the Joint Oversight Committee on Workers' Comp has now been revived. It was defunct for a number of years, and it has been revived. And I hope that the monitor will report to the Oversight Committee monthly, because the UEF is an agency that we just can't let fail.
Thank you for elaborating, too. We appreciate that, and we know will not be our last time talking about it.
No, it won't.
No. Colleagues, any further questions? Seeing none, thank you all so much.
Thank you. Okay.
Thank
All the
you.
best to you this session.
All right, now, colleagues, we're going to transition over to Maryland Emergency Medical Systems Operation Fund, MEMSOF. We'll begin with analysis from DLS from Ms. Miller. You can begin when you're ready.
Good afternoon, Chair Lewis and committee. My name is Madeline Miller, and today I'll be presenting the DLS forecast for the Maryland Emergency Medical System Operations Fund, or MEMSOF. The MEMSOF provides annual state budget support for the state's emergency medical services system. Chapters 717, 718, and 719 of 2024 modified the main revenue source to the fund, as well as increased expenditures for the Senator William H. Amos Fire, Rescue, and Ambulance Fund. Beginning in fiscal 25, the source of revenue for MEMSOF is up to $24.50 of a $40 annual surcharge on motor vehicle registrations, or up to $49 if collected biennially. There is a typo on the first page. I apologize, and it will be corrected. Funding from a $7.50 moving violation surcharge has also been credited to MEMSOF since fiscal 2014. As shown in Exhibit 1 on page 3, the fiscal 26 allowance provides for $110.6 million in total expenditures. Approximately 51.7% will support the Maryland State Police Aviation Command. Of MSPAC's planned expenditure, $5.5 million is contingent upon legislation expanding the allowable uses of the MEMSOF. This year's BRFA, HB 352 or SB 321, as introduced, would allow the special fund to support general operations instead of only MSPAC's medically oriented functions. The Maryland Institute for Emergency Medical Services Systems receives approximately $21.7 million. Exhibit 2 on page 4 shows MEMSOF expenditures from fiscal 2024 through 26. The working appropriation includes deficiencies for the Maryland Fire and Rescue Institute, or MIFRI, MIMS, the R. Adams Cowley Shock Trauma Center, and MSPAC. MIFRI receives approximately $679,000 for salary enhancements. MIMS receives $280,000 for the Pearl Tower renovation project. This tower project also receives $1 million in general obligation bond funding in fiscal 25. A deficiency also removes funding for shock trauma. The shock trauma remains an eligible use of the MEMSOF. Chapters 717, 718, and 719 created a new funding source for the Shock Trauma Center. Finally, a deficiency would reduce MSPAC general fund expenditure and increase its use of the MEMSOF by $5.5 million, contingent on legislation expanding the fund's eligible uses again. The allowance for total MEMSOF expenditures increases by 10.8% compared with fiscal 25. Most of the growth is attributable to higher expenditure for MSPAC. In addition to employee compensation enhancement funding, MSPAC costs increase for overtime and due to higher maintenance and repair costs for the helicopter fleet. MIMS expenditures from the fund increased by 12% between the 2 years. The agency receives additional funding for one new commercial ambulance inspector position, and software contract costs also increased for its patient reporting and provider licensure and certification system. The AMIS fund grows to the level mandated by chapters 717, 718, and 719, which is $16.5 million. Turning now to page 6, Exhibit 3 shows MEMSOF revenues and expenditures from fiscal 2015 through 2024. Revenues outpaced expenses through fiscal 2017, but were lower than expenditure during 2018 through 2022. The fund received general fund cash infusions in fiscal 23 and in fiscal 24, enabling it to close fiscal 24 with a balance of $17.8 million. Though actions were taken to reduce the fund's expenditures in fiscal 22 and 2023, expenses rose 20% between fiscal 23 and 24, resulting in a net operating deficit again. As shown in Exhibit 4 on page 7, MVA registration fee income reached a peak of $73.8 million in fiscal 2019. Over the fiscal 2015 to 2024 period, the income source was pretty stable, averaging $71.5 million per year between each year. The fund received $14.5 or $14.50 from the $17 motor vehicle surcharge at that time. That was $29 if collected biennially. Because the surcharge couldn't support the fund's expenditure without general fund support, BRFA and 2 other pieces of legislation from last year increased the annual surcharge to $40, with MEMSOF getting $24.50 instead of $14.50. Particularly for fiscal 2025, the resulting increase in revenue is difficult to predict, but the new level is expected to be substantially higher than in fiscal 2024. Exhibit 5 on pages 8 and 9 compares assumptions made by DBM and DLS when preparing forecasts of the fund. Exhibit 6 is the DLS forecast, and that's on page 10, provides the forecast through 2031. Appendix 2 on page 17 provides the DBM forecast through 2030. The largest difference in the DLS and DBM forecasts relate to our assumptions with MVA registration fees, as well as our assumptions with growth rates utilized for MIFRE, MIMS, and MSPAC expenditure starting in fiscal 2027. Previously, both of our forecasts estimated revenues in the working appropriation and the allowance in the out years by applying growth rates and registration fee income from MDOT's Consolidated Transportation Program forecast to the most recent year of actual data available. With draft data, the DBM forecast predicts that income to the MEMSOF will be $100.9 million in fiscal 25, while the DLS forecast estimates it'll be $94.2 million with January's data. These forecasted amounts exceed actual income by $30.4 million and $23.6 million respectively. It's difficult to precisely estimate the increase in registration fee amounts. However, due to the change in fees for which a full year of data is not available, potential changes in consumer behavior and other MVA changes, proposed legislative changes in fiscal 25, as well as proposed regulatory changes. Last year's fiscal note for the BRFA and the other 2 chapters assumed that the number of registrations subject to the annual EMS surcharge remains constant, and approximately 1/2 of owners who pay their registrations biennially are evenly distributed across 2 years. The special fund revenue for MEMSOF would increase by at most $45.6 million annually beginning in fiscal 25. Neither the DBM or DLS forecasts currently predict that for fiscal 25 only. But in addition to the change in the surcharge level, Chapter 717 authorized installment payments of registration fees as determined by the MVA. Though the option for a 1-year vehicle registration previously existed, it was only offered by request. At the start of fiscal 25, customers registering or renewing their registration were given the option to pay in 1 or 2 year period. And data related to this is shown as in Exhibit 7 on page 12. That exhibit relies on data through January 9th of this year, and shows that more consumers are registering for 1 year than in the 4 previous years. DLS expects that absent other changes, the impact of consumer shifts on registration fees will normalize starting in the allowance or in fiscal 26. Accordingly, our forecast assumes that the full expected revenue growth of $45.6 million over actual fiscal 24 revenues will be available to the fund beginning in fiscal 26. Other changes to the car registration collection schedule have been proposed. A provision in this year's BRFA would allow the collection of a reasonable installment fee impacting collections in fiscal 26, or potentially impacting collections. Additionally, a 3-year registration option could become available in the future. The second major difference between the forecasts is the growth rate methodology. Beginning with the fiscal 26 forecast, DBM assumed a 5% growth rate for MIFRE, MIMS, and MS PAC expenditures. Well, this is more conservative than the DLS methodology for MIFRE and for MIMS. It's over 1.9 percentage points lower for MS PAC. To forecast growth, the DLS forecast uses a 10-year average rate. By fiscal 2030, the DLS model estimates MS PAC expenditures to be $67.6 million, while the DBM model projects closer to $59.3 million. Based on these assumptions, both the DLS forecast projects that the MEMSOF will remain solvent through at least fiscal 2031 with an estimated closing balance of $20.5 million. Revenue sources to the fund are not inflation sensitive, so expenditures will exceed revenues over time. The current forecast predicts that ongoing expenditures will outpace revenues in fiscal 2030, while DBM's forecast puts that date in fiscal 2028. If MEMSOF expenditures did not increase in fiscal 25 and 26 to reimburse the general fund, the fund would earn additional interest income. In that scenario, the DLS forecast predicts there would be a closing balance of $32.9 million in fiscal 2031, approximately $12.4 million over the current estimate. So that's about $1.4 million in additional interest income. That income is not enough to change the overall health of the fund, and we'd still expect expenditures to exceed revenues in fiscal 2030. That concludes my presentation, and I'd be happy to take any questions at this time.
Colleagues, any questions for Ms. Miller? Seeing none, thank you very much. We have a number of folks here to join us for this. So let me grab this sheet to make sure I get everyone appropriately, but Chair Stamp, Mr. Thomas, Mr. Marlott, hopefully I said that correctly. Yes, there. Miss Christie? Over there? Okay. If that's okay. Yeah. You all will, yeah. That'll save me some time too. All right, you all can begin when you're ready.
So Chair Stamp is in sunny Florida. So I'm here in his place today. So good afternoon, and thank you for the opportunity to discuss the status of the MSOF Fund with you. My name is Sally Showalter. I'm a member of the State EMS Board. Members are all appointed by the governor. We oversee the statewide EMS system, review and approve the budgets of the entities supported by the MSOF. I'm a resident of Calvert County and represent the Maryland's rural counties on the EMS Board. Our Maryland EMS system is well recognized as a national model for emergency care. Our system is made up of volunteer and career personnel, medical and nursing personnel, communication, transportation systems, trauma and specialty care centers, along with hospital emergency departments. Our goal is to get the right patients to the right place in the right amount of time while delivering the highest quality of patient care. We also strive to do so in the most cost-effective manner and within our budgetary constraints. The tragedy of last evening is an unfortunate example of how we always have to be ready to do our best when the unthinkable happens. Last year's General Assembly passed critical legislation that increased the vehicle registration surcharge in order to eliminate a looming and potentially disastrous structural deficit in the MSOF. That increase also provided support to the Shock Trauma Center, the Maryland Trauma Physician Services, and the Amos Fund grants. You will hear from our partners today how vital this funding is to our day-to-day operation. We hope this funding change would result in the health of the EMS Fund well into the next decade. However, the latest analysis predicts the fund to be solvent only into 2030 or perhaps 2031. The EMS Board's proud to work collaboratively with all of our partners. As Maryland residents, we are all very fortunate to have so many dedicated professionals doing a really tough job 24/7, 365 days a year. We appreciate the leadership of the governor and the legislature, and I can assure you the board will continue to pay close attention how all funding is being utilized. Thank you on behalf of the State EMS Board. And now I'd like to introduce Dr. Ted Delbridge, the Executive Director.
Good afternoon, Mr. Chair and members of the subcommittee. Thanks very much for this opportunity. I'm Dr. Ted Delbridge. I'm the Executive Director of MEMS, or the Maryland Institute for Emergency Medical Services Systems. And by way of a quick background, MEMS is an independent state agency that coordinates all the components of the statewide EMS system. And we do that in part by providing medical oversight, promulgating statewide clinical protocols that are used by the EMTs and paramedics in the field, licensing and certifying EMS clinicians, approximately 20,000 of them, and operating a statewide communications center and designating trauma and specialty centers. The MEMSoft provides support for MEMS. Actually, it's the largest single source of support for MEMS, and initiatives that benefit our entire statewide EMS system. We're grateful for the efforts of the General Assembly to ensure the ongoing viability of the fund, and especially for the legislation that was passed last year to address the looming fund insolvency. The 2026 MEMSoft budget overview analysis by Madeline Miller is thoughtful, and we thank her for her work. I'd also like to acknowledge our DBM budget analyst, Christina Jorge-Tuñon. The backbone of Maryland's EMS system is the 20,000 men and women EMS clinicians that are certified or licensed by MEMS, who answer more than 1 million calls for help each year. That's more than 1 out of every 6 Marylanders who accesses the EMS system, at least statistically so. Some people use their chit more than once. These clinicians treat patients in need of life-saving emergency care using the protocols that we promulgate. They use a statewide EMS communication system maintained by MEMS that provides communications capabilities for the EMS clinicians in the field to consult about patient care decisions with hospital-based station physicians throughout the state. And they transport patients to designated trauma and specialty centers that have been verified by MEMS as capable of providing timely and high-quality care, including 10 trauma centers, 24 cardiac intervention centers, 39 stroke centers, 2 burn centers, and 15 perinatal centers. In 2024 alone, MEMS re-verified 31 of these specialty centers. MEMS is closely monitoring EMS to emergency transfer times. That's the elapsed time it takes for an EMS crew to establish a transfer of care of their patient with hospital emergency department staff. We supply weekly reports to emergency department and hospital leaders in hopes that they will use this to improve processes and monitor progress in prioritizing arriving EMS patients. And we supply monthly data to the HSCRC to help them with their challenge to engage hospitals in its emergency department dramatic improvement effort. Once EMS care is completed, care is documented by EMS personnel on a statewide electronic patient care record system that MEMS manages, and we continue to work with Chris to ensure that EMS patient encounters are considered part of the patient's healthcare continuum and part of the patient's permanent medical records. We support efforts to provide care before EMS arrives at the scene, and an example of that is the public access automated external defibrillator program, which we recently expanded to ensure that statutory requirements for AEDs to be placed in restaurants and grocery stores was possible and able to be tracked. We are working hard to meet an October 1st, 2027 deadline to supply naloxone to be co-located with AEDs in certain public places. And we're looking forward to legislation that's pending this year that will require AEDs to be in libraries as well. These are just a few of the ways that the MEMSoft funding helps us fund Maryland's EMS system and enables us to do the work that we do every day. Thanks very much. I'll turn it to Captain Jeffries.
Good afternoon, Chair Lewis, Vice Chair Ivey, other members of the committee. My name is Captain Jeffrey Thomas. I'm the Assistant Commander of the Maryland State Police Aviation Command. I'd like to take this time to formally thank Madeline Miller for her comprehensive analysis, as well as the committee members for your support of our department and the other partners seated before you here today. The Maryland State Police Aviation Command has proudly served Maryland for 54 years, delivering critical services like medevac, law enforcement, search and rescue, and disaster response. We operate 10 advanced AW-139 helicopters and a fixed-wing aircraft from 7 bases. The Aviation Command has transported nearly 200,000 patients since 1970. The department has submitted written testimony which provides some background information on our program and mission statistics for the past year. In 2024, Aviation Command personnel safely completed 1,878 medevacs 201 search and rescue missions, 14 aerial rescue operations, and 1,935 patient contacts. Our life-saving whole blood program continued to advance with 211 units transfused to 163 patients upon its inception, including 134 units and 100 patients in 2024 alone. The program operates efficiently, rotating 1,163 units of blood without waste by returning the unused blood to shock trauma for other patients. The Aviation Command expresses deep appreciation for the collaborative efforts of the House and Senate Budget Committees, the MSOF Coalition, the Emergency Medical Services Board, the Department of Budget Management, the Department of Legislative Services, in addressing our budget challenges. The resolution of the MSOF's forecasted insolvency during the 2024 legislative session was vital. With your continued support, the Aviation Command is committed to utilizing the fiscal year 2026 budget efficiently to uphold its mission of delivering exemplary airborne public safety aviation services to Maryland citizens. Thank you.
I'm Pat Marlette. I'm the Deputy Director of the Maryland Fire and Rescue Institute. I'm here today on behalf of our director, Mike Cox, who couldn't be here, but he did submit written testimony. MIFRE is the state's emergency services training organization, and we train between 25 and 35,000 students a year. I'll be glad to address any questions you may have, and we appreciate your favorable consideration.
Thanks. We have two more partners.
Yeah, but just pause for a second. Before you all switch, colleagues, do you have any questions for the people who are currently here? Seeing none? Okay, thank you.
Thank you.
You can switch.
Good afternoon, Chairman Lewis and Vice Chair Ivy and members of the committee. I'm Eric Smothers. I represent the Maryland State Firefighters Association across the state of Maryland. I'm also the chair of the State EMS Medical Advisory Committee. The Maryland State Firefighters Association has 360 volunteer fire departments across the state of Maryland, which represents 24,000 fire, rescue, and EMS personnel across the state of Maryland. We certainly appreciate the efforts from the committee and the budget increases that we received last year through the MSOF funding. The money that's received through our volunteers is through the Senator Amos Fund, which also helps offset our costs. As we all know, the rising costs of medical equipment as well as fire rescue and EMS equipment is almost taking a 25% increase across our state. So the majority of our departments rely on this additional funding source to offset any additional training and or equipment needs across the state of Maryland. So we continue to look for your support in supporting the MSOF fund.
Good afternoon, Mr. Chairman, Vice Chair, members of the committee. My name is Christy Snedeker. I am the Vice President of the R. Adams Cali Shock Trauma Center. Extremely grateful to be here today amongst my colleagues here in the MSOF. You see us come here every year together as a group of entities that are committed to providing the safest and fastest and most efficient care to all Marylanders and beyond if you get into an accident here in the state of Maryland. Last year, as you heard, the gratitude from my partners, I will echo that gratitude in the respect of the work that this committee did and the legislature did in shoring up Maryland's trauma system. You've enabled us as the primary adult resource center to function at our fullest capacity, to be the park in which we are the backstop for the Maryland trauma system, for all trauma hospitals, to be open at the ready and to receive any patient at any time, 365, 7 days a week. And we are happy to do so, and we are privileged to do so. With the influx of the special funding that's been mentioned and our MSOF funding, we are able to stay open. We're able to see patients sooner. Patients are getting their operations sooner, which is in turn producing a reduced length of stay, which allows us to bring more patients in and our patients to get home sooner and to return to work and be productive members of society. Not only are our patients seeing the benefit, our partners at our trauma hospitals are seeing the benefit. Our partners at Cap Region and Prince George's County are seeing the benefit of training and education components from physicians and sharing best practices and the ability to come and share and learn from us at the Shock Trauma Center, as well as the injury prevention and violence intervention that's happening across the state of Maryland. With that special funding and the shoring of MSOF, we've been able to ensure that our vision for every high schooler in the state of Maryland will receive Stop the Bleed training. We've been able to almost hit every high school in Region 3, Prince George's County, Western Maryland, and we are on the Eastern Shore as well, partnering with Tidal Health. It's extremely important for the public safety of our students in high schools, of government agencies, of public agencies, that we have these resources open and available, and what you provided for us last year is allowing us to do so. Based on the fiscal note and budget analysis provided by Department of Legislative Services and the Department of Budget Management from last year's legislation, we believed that the R. Adams Cali Shock Trauma Center would remain in MSOF alongside my esteemed colleagues and partners here, receiving that $3.7 million annually. We're pursuing further clarification from our colleagues in the Department of Budget Management as well as your analysts as to this annual funding. We certainly appreciate a continued conversation. We appreciate your support, and I'm happy to answer any questions you may have. Thank you for your time today.
Thank you all so much. It's good to see you. And I believe that Ms. Miller informed me that some of your staff did deploy last night from the various components to aid with the crash that happened. That might have been state police. But thank you all for your service. I just wanted to have that on the record too. I see there's a question from the vice chair.
Thank you, Mr. Chair, and I'd like to echo those sentiments for all the individuals that have been deployed and doing the very difficult work. We see how important this discussion is. My question is for you, Ms. Snedeker. I look here, it says that you're here in support with an amendment.
Yeah, so Vice Chair, it was difficult for me to say favorable with an amendment, sure, as we believed we would be coming together in MSOF for the $3.7 million that we traditionally receive. So not understanding potentially how we got here today as far as the R. Adams Cali not being in MSOF. Based on like I said, based on the fiscal note last year, it didn't depict that would be the case this year.
Thank you, I appreciate it.
Sure.
One thing I remember from last year too, and we will definitely have more offline conversations about this too, is that through the 3 chapters that changed, I believe there was other areas of revenue too. So I think we as well are trying to get a comprehensive picture of the appropriate support that should be going to shock trauma specifically as well.
Absolutely. Thank you so much for the continued conversation, and certainly know that we appreciate, coming here with our partners. We are the representation of who is at the ready at the state of Maryland. You mentioned the airplane and helicopter crash last night. MIMS sent out an alert. We were all at the ready in hopes to have survivors from that accident. With the unfortunate news that there were none. So certainly we appreciate being up here with the coalition. We're tight partners, and we are working side by side to take care of those of us in the state of Maryland.
Yeah. Thank you all so much. Colleagues, any further questions? Seeing none, thank you all for coming out here today. It's always a pleasure. Thank you for the work you do for the state of Maryland. And with that, we are adjourned. Have a great day.